Welcome, everyone. We're going to give it a few more minutes to allow, actually 1 more minute to allow folks to continue to log on. While we're waiting, we want to let you know that today we have ASL interpreters Kelly Solzbach and Margaret Hall joining us. To be able to see them, please select the grid view or pin them so they remain on your screen. To pin or make the ASL interpreter's web camera your primary camera, please hover over the web camera image and click on the pin icon. And then click on Kelly Solzbach and Margaret Hall. Or you can select the grid view and you'll be able to see all of the panelists' faces. Thank you. All right, we're going to get started. Welcome again. This is Denise Solzbach. I am the director of the National Center at the Institute for Innovation and Implementation at the University of Maryland, Baltimore School of Social Work. And I'm the deputy director of the TA Network. Today's conversation is about managing now for better tomorrow. We will be tweeting throughout this discussion. If you would like to join us, please use the hashtags BetterTomorrow and TA Network Talks and tag us at Institute UMSSW and NCSMH, that stands for National Center for School Mental Health, tweets. We do hope this conversation finds you safe and well today. We recognize this is a challenging time for all of us in children's services across the country, most especially the families and the youth we serve. We have created these conversations for you to have peer-to-peer opportunities, for you to talk with the presenters as well as one another. We encourage you to use the chat box to share your thoughts and resources as well as questions for the presenters. When you use the chat box, please be sure to select all participants. This will allow everyone to see what you are sharing. In follow-up to today's discussion, we will send everyone who registered a link to today's recording, as well as resources and insights shared in the chat box. So please light up that chat box, share those resources, and we'll make sure to document them and send them all to you in follow-up. This will very much be a conversation today. You will see the presenters joining us from their homes, and we will not use a PowerPoint during this discussion. And this series is truly about managing now for a better tomorrow. Together, we are stronger in creating forward-looking solutions to meet the challenges of today while building a brighter tomorrow. And we do value your participation. As I said, this has been a conversation series during COVID-19. This is actually our 12th discussion. We have conversation recordings available for you, including crisis communications. We had 2 discussions on them. In-home behavioral health. We also had 2 discussions on supporting families, as well as 1 on residential interventions. 2 discussions on infant and early childhood mental health. 1 on mobile response and stabilization. Last week, we had another discussion about school mental health, focusing on supporting students and families. And we also had 1 on housing and homelessness. On tomorrow, we will be hosting a discussion on rural mental health at 2 p.m. Eastern Time. And we are working on additional conversations for you about supporting tribal communities, as well as 1 for young adults working in children's services, and 1 on serving LGBTQ youth during COVID-19. To sign up for our upcoming conversation tomorrow, as well as access resources from our prior conversations and other resources on COVID-19, please go to our website at theinstitute.umaryland.edu/COVID-19. You can also get our weekly TA telegram by subscribing to us. If you're not already subscribed, we'll be sure to put that in the chat box. As you're aware, today's conversation is on school mental health, supporting educators. Our panelists and presenters include Sharon Hoover. She is the co-director of the National Center for School Mental Health at the University of Maryland School of Medicine. She's also a licensed clinical psychologist and associate professor at the University of Maryland School of Medicine, Division of Child and Adolescent Psychiatry. She is joined by Pamela Vona. She is with the Susan Dwork Peck School of Social Work at the University of Southern California, as well as Michelle Malvey with Lincoln Elementary School in Loveland, Colorado. We're also joined by Jane Walker. Jane Walker is a senior advisor and former executive director of the family-run Executive Director Leadership Association, known as FREDLA. Also today is Liz Manley. Liz Manley is with us at the Institute for Innovation and Implementation at the University of Maryland School of Social Work. Many of you may know Liz as she is the lead technical assistance contact for several sites throughout the nation. And she also leads the TA Network's clinical workforce improvement work. We're also joined by Dr. Christopher Balanci. Dr. Balanci is at the Judge Baker Children's Center at Harvard Medical School. And Christopher serves as the medical director for the TA Network. Finally, and most certainly not least, we have Selena Webster Beck. Selena is with the Voices Institute. Selena is part of our expert consultant base on cultural and linguistic competency for the TA Network, and she is very active in our cultural and linguistic competency learning community. I'd like to again welcome all of you, and I'm just going to repeat the instructions with regard to the ASL interpreters. If you would like to participate in the interpretation service, please hover over the pin and select Kelly Sobey and Margaret Hall, or put your screen on the grid view. We also call it the Brady Bunch view, so that you can see all the presenters. Thank you very much for joining us today. And with that, I'm going to turn it over to Dr. Hoover. Sharon?
Thank you so much, Denise. And it is a pleasure to be here to help facilitate today's conversation with everybody. And we've already seen several of you introduce yourself with indicating where you're residing, where you're from. So please, if you haven't already, please say hello. Take the opportunity to let us know you're here and where you're from in the chat box. So hopefully you can all find the chat box. It looks like a little word bubble in the bottom of your screen if you hover down there. So we'd love to hear where everybody is from while we start doing our own introductions. Thanks so much. We're seeing folks from all over now joining in. So as Denise said, our goal today really is to engage you all in a conversation about school mental health, and today specifically about supporting educators. And we anticipate hearing about ideas for promoting mental health and well-being among educators, addressing stress, including traumatic stress of educators, and also about helping our educators support the mental health and well-being of the students and families they are supporting. And finally, we anticipate moving into a conversation about preparing educators and schools for returning to school, or what some are calling the new normal, whatever that may look like and whenever that may happen. And our goal really is to learn about specific experiences from the field and to brainstorm solutions and innovations with your peers from across the nation. So we'll do just a very quick round of introductions and then dive into some questions. So again, my name is Sharon Hoover. I co-direct our National Center for School Mental Health, and just a little bit about my lens as I embark on this conversation with you. I served as a clinical psychologist in city schools in Baltimore for a number of years, and have 3 children of my own in middle and high school right now. And so I'm navigating some of the distance learning that's happening in many schools, as well as working primarily from home at this moment in time. And our national center has been funded since 1995 out of the U.S. Department of Health and Human Services to support education and behavioral health leaders across the nation in this intersection of education and behavioral health. And we partner with many organizations and partners across the country to do so. We also serve as a community behavioral health provider to a number of schools across Maryland, primarily in Baltimore City and Prince George's County, two of the communities actually that are hardest hit in Maryland right now by the pandemic. And as with all of us, our work and our personal lives really have taken a pivot over the last several weeks, and we've been working to support schools and educators and students and families in the context of this pandemic, and trying to respond to a range of requests from students and families and schools and other organizations. And one of our primary concerns really has been, how do we best support educators? So that's what we're hoping to discuss with you all today. We do have a website. I know that it was already placed in the chat box. Thank you so much for doing that. And I'll also go ahead and put some of our resources throughout the conversation, but we also encourage you to share resources as participants as we navigate our way through today's discussion. I'm going to share the site of the first panelist that I'd like to introduce herself. That's Pamela Vona, who we've worked with from the National Child Traumatic Stress Network for a number of years. Pamela, if you could just say hello, let us know you're there and a little bit about yourself. And
Sure. Can you guys hear me okay? Great. So first, I just wanted to say thank you to you all for allowing me to participate today. For the past several months, I've been nothing short of amazed by the way our nation's teachers have stepped up during this time, and I'm just so happy to be able to provide some, what I hope is helpful information to really support our educators. Just a little background about me. I'm a research associate at the School of Social Work at the University of Southern California. The past 6 years, I've been with the Treatment and Services Adaptation Center for Resilience, Hope, and Wellness in Schools. We are also a federally funded center out of Health and Human Services, and we're comprised of researchers from USC, UCLA, and the RAND Corporation. And really, for the past 25 years, our center has been charged with the mission of developing effective school-based interventions for students and staff exposed to trauma. So in this capacity, I've helped to develop two curriculums, one called the Trauma-Informed Skills for Educators curriculum, and the second one, which I think is particularly relevant today, is the Support for Teachers Affected by Trauma curriculum. Additionally, I'm a curriculum developer with the UCLA Prevention Center of Excellence, and have developed a curriculum called Cultivating Compassionate Schools. And we're also working on a COVID response curriculum, very simply named Supporting Educators During a Pandemic. So I hope that some of this information, my knowledge, can be shared in a way that's beneficial to all of you on the call today. Thanks again for allowing me to be here.
thank you so much, Pamela. Really happy to have you here. And next, I would like for Michelle Malvey to say hello and let us know a little bit about you as one of our panelists.
Hi, can everyone hear me okay? Wonderful. I feel a little like small compared to these big names that are parts of big organizations. But I also know that all the work they do is so that people like myself and the people I work directly with can put that learning into action with students. So I am a school psychologist that is currently functioning, working as an elementary principal in Loveland, Colorado, just north of Denver. I've been in public education for 33 years, and I'm actually like partially retiring at the end of this year. So who would have known that they would go out this way? I would just say that our teachers are phenomenal. They're amazing. They are doing amazing things, as are our kids and our families and our communities, to step up during a time that we would never have seen coming. My school in particular has done a lot of work around trauma. My background as a school psychologist certainly lends itself towards understanding that whole child perspective. And I'm a longtime volunteer for the National Association of School Psychologists. I know we have Stacy Scalzi on the call from NASP as well as our state organization. And so my lens is always around how do we provide services not only for the whole child, but our whole community. And this has given us certainly that opportunity to continue to do that. And we have to figure out a way to take care of ourselves at the same time that we are taking care of the communities that we serve. So very privileged to be a part of this, and I hope to learn from all of you as well. Thank you.
Thanks so much, Michelle. And we will be hearing from Michelle and Pamela as we go on today. And one more introduction before we dive into some questions for our panel and also for all of our attendees today. Selena Webster-Bass, can you let us know that you're there and say hello and a little bit about you?
Yes, good afternoon, everyone. Delighted to be a part of the conversation today. Kudos to all of the educators that are involved with virtual learning. I have a middle schooler, a high schooler, as well as a college student that came home from University of Pennsylvania in Philly. So lots of virtual learning going on in our home. So just delighted to be here. I am Selena Webster-Bass, CEO of the Voices Institute, which is a training, health education and research group focused on health equity, cultural competence, and the social and emotional well-being of children, youth, and families. My experience has been based in Jacksonville, Florida, working with the Jacksonville System of Care initiative in promoting mental health in communities of color, working with faith-based partners, as well as around organizational cultural competence. So I'm excited about bringing the equity lens to the conversation today. Thank you.
Thank you so much. Really appreciate your participation today. I'm just going to ask that all the panelists mute themselves because we're having a little background. Okay, so today we want to hear from all of our panelists, but also really all of you as attendees today, both about the challenges that you're experiencing during this pandemic, but also some of the successful strategies that you've employed to support educators during this time, or that you've used if you are an educator during this time. We've found that some of our partners and a lot of the individuals that we support have commented that they're saturated with resources and webinars. And so I'm really grateful for this conversational approach because I think it fosters peer-to-peer learning and support, which is what I think a lot of us are really hungry for right now. So we encourage you in that light to actively use the chat feature of this WebEx. And we have some questions to get the conversation going with our panelists, but we are relying on you both to ask questions and to answer questions. So we'll probably follow a general flow of first talking about some of the challenges and demands on teachers and how to support their well-being, and then talk about how educators are supporting student and family well-being, and then finally considerations for returning to school. But we'll see where the chat takes us and encourage you all to guide the conversation as well. So let's go ahead and start with a conversation to all of you, all of our attendees, that we'd like you to respond in the chat. What are the most prominent concerns that you are hearing from educators right now? And while you all are chatting and putting your responses into the chat box, I'm going to direct that similar question to Michelle Malvey. What are the most prominent concerns, Michelle, as a school administrator that you are hearing from educators right now, either in your school or district or some of the partners that you hear from?
I would say that the biggest thing is, we have a huge concern over what Selena talked about, equity. Are we reaching our most at-risk kids? My school does happen to be a Title I school, and we're highly concerned about making sure that our students are getting what they need from the basics, that their housing's secure, that their food's secure. So that's the first piece. And then we just know that learning is all about social connection. You could have the best laid plans in the world and the best instruction ready to be delivered, but if you don't have relationships with students and you don't have connection and purpose behind that learning, you're not going to get it at that same level. So that's their biggest concern is, are they really connecting with kids? Are kids okay? Are families okay? And who are we in this virtual setting? I used to be the person that greeted every kid every day, that could tell by the look on their face if something wasn't going well, if they just needed someone to listen to, or they just needed to go sit in the cozy corner for a few minutes. It's a big question of like, what's our worth in this new environment, and how do we find ourselves in that? Because, and I do believe this is a silver lining as well, is it's an opportunity for us to really focus on that we don't teach content, we teach humans, right? And our job is to prepare the brain to learn, and that requires so much more than a tech device or a great set of lesson plans. So number one is, are our kids taken care of, and how do we fill the void we're feeling? At the same time, we know that void is being felt by them, and how do we bridge that huge gap?
Yeah, thanks so much. I think some of the themes that you mentioned were resonated by the comments from, our participants in the chat box. So, some specifically highlighting kind of how to reach specific groups of students or most vulnerable students. For example, Jesse mentioned how to reach and address ELL students. Ursula mentioned, just participation and access as one of their primary concerns. And then Jesse also mentioned, concerns about the academics, right? So that's one piece, and how do we address the extended loss of learning? But Tiffany mentioned something similar to what you had said in terms of how do we assess the safety of our students, right? So as educators, when you have person-to-person, in-person contact on a daily basis, it seems much more easy. It seems much easier, more familiar to assess how they're doing, what is their emotional status, and their safety status. And it's quite difficult. We've heard from so many educators to understand what's really happening with their students on a daily basis. So thank you. It sounds like a number of our participants share your concerns. Akia mentioned, and this is aligned with that same concern, that many students might be in an abusive at-home environment, or certainly be more vulnerable right now at home. And how do we assess that as educators? There are anticipated increases in family violence, and that's not surprising given some of the huge strain on families right now, and the economic burden, as well as the health burdens and other concerns. And so when some of our reporters, or the folks who are really the eyes and ears and the safety net, our educators for our students, are not able to connect daily with students, it's a real concern. So thank you to everybody sharing these concerns in the chat box. And I want to ask, related to some of the concerns that have come up, Selena, if you could speak to us for a few moments about how is COVID affecting communities of color specifically, and other vulnerable populations, and maybe also what are some COVID-19 equity related concerns for educators. And while you're doing that, Selena, if others could speak to that, and maybe how they're seeing those issues come to light in your own communities, or resources that you've used for that particular issue around communities of color and equity related concerns.
Thank you so much, Sharon. So COVID-19 has exposed, or really just shined a light on, existing disparities and disproportionalities in communities of color and in vulnerable populations. And, epidemiological data shows that, African Americans are dying at much higher rates than white Americans, and partly because of pre-existing chronic conditions such as hypertension, diabetes, asthma, also because of lack of health insurance or being underinsured. And there have even been some reports of people being turned away from hospitals seeking treatment that were presenting with symptoms. And we can't talk about COVID without talking about systemic racism and policy structures and practices that reinforce racial inequities within communities. Another contributing factor is also the wealth gap. Low income families and many people of color are working in jobs where they can't work remotely, or they have more face-to-face time with the public, which increases risk of exposure to the virus. So many communities are implementing strategies around, collecting reliable, accurate demographic data related to COVID infection rates and death rates, as well as ensuring equal access to testing and advocating for policies that stabilize families economically. Now, related specifically to education, recently there was a survey that was conducted by Teach Tolerance, which is a web-based resource for educators. They surveyed 2,000 teachers and asked them specifically, what are your needs in terms of COVID-19 and equity issues? And some of the issues that emerged from that survey, one was a concern about digital access, that many children who are now learning from home do not have access to the internet, or may not have a computer in the home. So many schools are implementing creative solutions, in terms of giving out laptops, giving out hotspots. Also, I recently read an article about Wi-Fi enabled school buses that are being placed in underserved neighborhoods, which I just think, again, one positive theme that has come out of the pandemic is the creativity of organizational leaders in coming up with solutions. Other issues, as was previously mentioned, teachers are concerned about children having the basic necessities, food insecurity. Many students were eating breakfast, lunch, and dinner, if they're an extended day, in the school. And so, many schools are setting up, lunch drop-offs and dinner drop-offs and those types of resources, as well as partnering with organizations such as Feed America, so that kids can have access to healthy foods. Another issue, which is specifically related to bias and racism, educators are concerned about the anti-Asian sentiment around the Chinese virus, the language that we're using that stereotypes groups of students. And so having the opportunity to create virtual spaces of compassion and graciousness is really important to educators as well. So those are some of the concerns that are really important from the equity perspective.
Selena, thank you so much. Really important to get your understanding. And I know while you were speaking to some of those issues, a few really excellent resources were shared in the chat box, including one, a video, it looks like a great resource on systemic racism and COVID and the interaction there, and how this has really amplified some of the structural inequities that existed before COVID. And I also see that our colleague at the National Association of School Psychologists, Stacy Skalski, has shared some of their resources, and I know that they have some resources specific to educators addressing discrimination and racism in the context of COVID on the NASP website. So I encourage you to check out some of the resources that are being shared here. And also, Selena, you spoke to some of the creative ways that communities are coming together to address some of the inequities, whether it's food insecurity. We're seeing meal pickups, and we often at those meal pickups, we're having some student support staffing available, whether it's a school counselor, school psychologist, or others who are available at meal pickups. We've seen in many of our rural communities, the school bus Wi-Fi service, as you said, or schools redirecting their Wi-Fi out to the parking lot so that families can try to have greater accessibility. And we see Anita mentioning that the food drop-offs or pickups have been incredibly helpful in her community as well. And also Donna's pointing out that a lot of educators don't have internet access at home. So we've talked a lot about students not having access, but also many of our educators don't. And so we have educators who are learning a whole new modality of teaching while also navigating some of the difficulties with access. So Michelle just shared an article on school bus Wi-Fi in Austin that hopefully some of you will be able to check out. So thanks so much for that perspective, Selena, and I hope that we can continue to have conversations on that theme throughout our discussion today. I want to ask, we've spoken about the adversities that so many of our young people and families and educators are experiencing during this time. And we anticipate that educators will experience traumatic stress, including secondary traumatic stress from working directly with so many students and families directly impacted by COVID. So Pamela, I wonder if I could ask you just to speak for a moment about, why educators are especially at risk for secondary traumatic stress right now, and some of the things that we need to be thinking about, and maybe some resources to share in that area.
Sure. So thank you for that question. For those of you who may not be as familiar with the concept of secondary traumatic stress, one of the ways that it's defined is really the duress that you experience after hearing about the firsthand trauma experience of someone else. And we know that there are potential risk factors that make you more likely to experience STS. And I think this crisis is uniquely challenging because it really seems to be heightening what we know to be those risk factors, while at the same time reducing our access to some of the protective factors that really buffer us from secondary traumatic stress. So for example, we know that STS is more likely to develop when educators have their own overwhelming stressors. Well, I don't know many people who haven't had a lot more stress put on them because of the pandemic and how it shifted and disrupted all of our lives. We know that secondary traumatic stress is more likely when the workload feels overwhelming. Well, having to learn an entirely new modality of teaching and deliver it and set up a whole classroom in your home is certainly a monumentous task being asked of everyone. Another really big one is STS is more likely to occur when an educator feels ill-equipped to support their students. And I think everything that I was seeing come through in that chat box, everything from supporting the emotional well-being of their students to the day-to-day needs of students. We are obviously limited in our ability to do that. So that's really enhanced that risk factor. And then finally, the more of you, the greater percentage of students that you have that are trauma exposed increases the likelihood of developing secondary traumatic stress. And so we've gone from the days where maybe a portion of a classroom were students who had been exposed to trauma, and now it's hard to imagine that a majority, if not all students right now are dealing with significant stress, and for many, stress that's rising to the level of traumatic stress. And like I mentioned, at the same time, our buffers have been lessened. So for example, we know a buffer is having a predictable and consistent routine. I mean, we know that's true for our students, but it's also true for us. That provides us stability, and everything has been upended. And then I think another protective factor that's critically important to think about is the peer support of our colleagues. And we're no longer in the days where we can see a colleague in the hallway, check in. And so I think a platform like this has so much wisdom in it, because educators are not isolated in their home just looking at slides, but we're able to have a conversation and to connect with colleagues. So I'm really grateful for that. But I don't want to be doom and gloom. I know our educators are amazing and resilient, but at the same time, I think it's really important to highlight the fact and raise awareness that these conditions are really lending themselves to increasing the likelihood of STS for many educators. I have some resources that I'm happy to share. One of them is the resource that I mentioned earlier. The curriculum, it's an online curriculum called Support for Teachers Affected by Trauma. It's free of charge, publicly available. I will type it into the chat. But there's really if there's one thing that I would want everyone to take away from today, it's that we no longer can think of self-care as a luxury, and that it's something that we do when we find a moment and have some spare time. Or as a colleague of mine says, self-care is really more than yoga and veggies. And I really see self-care as needing to be woven into our daily routines in the same way that COVID has called us to weave in hand washing more often, or in the same way brushing our teeth has always been a part of our daily life. You know, every day we turn on the TV and we're hearing about physical immunity. What's going to make me less likely to get the virus, or how do I keep myself immune from the virus? And I think we need to be having a parallel conversation about our psychological immunity and how we build our resilience and psychological immunity to stress. And I think if we think about it in the same way we think about physical immunity, then it has that additional emphasis and that additional importance.
Great. Thank you so much, Pamela. And I know that our hosts today have already posted some of the resources you mentioned, including the free online training for teachers affected by traumatic stress in the chat box. And a couple of our attendees have already said the resources are helpful and they want to make sure that they can get access to them after today. And the answer is yes. Our hosts at the Institute will be putting together a compiled list of all of the links. We don't expect you to be copying and pasting or writing any of these down. So everybody who's registered for today's webinar, as you'll see in the chat box, will receive a recording of today's discussion along with a compiled list of all of the resources. And we're already seeing that some of you are sharing resources, which is really one of the things that we find the most fruitful from these discussions. So I want to ask of all of our attendees, and then I'm going to ask Michelle Malvey specifically, what are the best resources and just strategies that you have seen to support educator self-care? So if you could all start sharing in the chat box, whether it's a resource or just a strategy that you've used or that you've seen in your community that educators are leveraging to support their own self-care. And Michelle, I'd love to hear from you about any resources or strategies you've seen that's to support educator self-care.
Excellent. Well, listening to Pamela talk was, we do the things that we take for granted, passing in the hallway and having that quick laugh with each other, just taking a moment to be goofy or to cry, literally cry on someone's shoulder. We can't do it in the same way. I agree with Pamela in the sense that, I'm so thankful for these venues that allow us to at least see each other. I know most of my colleagues hold some office hours each week, and anyone can just chime in and we can just see each other and we can talk about something that has to do with school, or we can talk about how the fact that I have a sophomore and junior in high school who aren't doing very much and are lucky that I'm really busy because I can't be on them all the time, or whatever it might be that we need to do to connect as humans. In addition to that, at our building we've done, and at several buildings in our district, we've done a lot of work around the neuroscience in the brain and what happens to us when we're in different, fight, flight, or freeze kinds of modalities. And that's what trauma does to you, whether you're dealing with it directly or through a secondary status. We have worked at my school, and two others have worked as part of a grant with Kaiser Permanente over the last few years to work on those before all of this happened. And we've done a lot of professional development with our teachers. And it felt like a lot of it went out the window when this happened, right? Because just like everyone else, no one anticipated something like this. We've never endured something like this. So no matter how much you plan for crises or find yourself to be a problem solver, you still are like, whoa, what am I gonna do now? So my partner in some of that work, her name is Judith Norman, and she has created 5 videos, and I will do the link for that. It's through Brain Drops Play Therapy, which is out of Fort Collins, Colorado. Her name is Judy Norman. She does that half-time, and then half-time she is the SEL coordinator for our district, Thompson School District, and she has created those 5 videos, and we've asked all of our staff to just watch those, sometimes repeatedly, and they talk about how to stay regulated when you're in someone else's house. We've not taught in someone else's house before, and now we're teaching looking at a screen, and it's hard not to be distracted by anything that goes on behind us on the camera, and yet we're still scanning for our kids safe. What's their interaction like with their family members, all of those kinds of things. So there's 5 videos that we've used a lot around that regulation and how to take care of yourself. And I feel like a huge part of that is starting every meeting that we have with a connection activity, a chance to laugh together. And I think some of the comments coming through are saying that as well. You know, just what are the practices that we used to have in place, and make sure you still do those and maybe do more of them. And remember to do that with kids as well. Certainly for educators, permission to take care of yourself. As an administrator, I find myself saying, like, don't feel guilty if you actually got to sit down and taste your lunch. You know, don't feel guilty if you took a 30-minute nap, because now you're going to be helping someone whose mom doesn't get off work until 6 with their math assignment tonight. You know, take care of yourself. You have to. You're only as good of an educator for the kids and community that you serve as you are to yourself. And we're out, like, so many of my staff have their own children, like many of you have talked about. And so take care of yourself. Don't lose sight of connection. Relationships among adults are just as important as our relationships with kids, and connect in as many visual ways as absolutely you can make it possible.
Thank you so much, Michelle. We are seeing incredibly creative and positive ideas from our participants today. Everything from Akia saying that they share memes every day around self-care or strategies or humor, to Laura saying they have morning coffee check-ins on Google Meet, and Ursula really resonating with what you said around the idea of self-compassion being equally important. Dawn asks all of us, Dawn from Nebraska, asking if there are some apps to assist with self-care. So if any of you have some apps that you'd like to share, I already see a couple shared around Do Yoga With Me. I know there's Calm, CALM.com. Natalie shared Greater Good in Education, which I know a lot of folks are using. And it looks like Judy shared the Brain Drop Play Therapy site that you brought up, Michelle. So she's done your job for you, which is great. Thank you so much to everyone participating here. And I want to bring to light a question that one of our attendees mentioned. So Julie Schleibner says, rather than asking teachers to do more by having them take care of themselves, what systems can be in place from the larger school or district community to create and support teachers? In other words, what can we offer them rather than expect them to take care of themselves? And Julie, my very next question really had to do with that theme, which is, you know, the idea that we can't put the onus all on teachers to take care of themselves. And that's come up pre-COVID, that there was kind of a shift towards self-care and recognizing the importance of self-care for educators, but then a more recent shift towards organizational supports for teacher well-being. So in that light, I would ask all of you, and then back to Pamela and Michelle. I'll start with Michelle again, and then ask Pamela. What are some things that organizations, including district and school leaders, can do right now to support educator well-being? So not so much kind of what can the educator do that's self-initiated, but what are structures or protocols that can be put in place? So one, for example, that we heard recently from a district in South Carolina, the district leader had put in place essentially a triage system for the summer, where they're doing an assessment of social emotional well-being needs of educators, and then directing them to mental health supports over the summer in preparation for returning to the school year. And there was kind of a whole protocol for doing so. So any ideas for that in the chat box? And then back to you, Michelle, about any ideas that you have in terms of some organizational structures or processes to support educators.
Sure. I'm really, really lucky to both be a part of NASP, which provides lots of things for school psychologists around the country, but also in my own school district to have a superintendent who really values human capital. So we have a lot of structures in place. to support our kids and ourselves. And I think part of supporting ourselves is also knowing that we have everything in place to support our kids. If we feel like we don't have those systems in place, then we're not likely to access systems for ourselves until we're sure they're taken care of. It's just the nature of who we are as educators. So we started with that first, and as systems, we have like calming corners in every one of our virtual classrooms for our kids. We've adapted PBIS structures for both the teachers and the students, so it feels more connected. And then we have referral structures in place, both for students to reach out and ask for help, and also for staff to reach out. We're very lucky to have an employee assistance program that's already well ingrained in our district, and so is available, and feel like the messaging that comes from the organization of the school district, and certainly even our community beyond that we value you and as educators, and we know that this is very difficult for you, and we are here to support you. So just a variety of different structures. Hopefully I answered that more. It was kind of broader in terms of specifics, but we've got like a stage 5 referral form that we use, like to connect with each of our kids. And then as administrators, we're kind of doing that with our staff as well. Not as formalized of a practice, but after listening to this, I'm thinking maybe we need to formalize it a little bit more before we disconnect for the summer in a few weeks.
Yeah, it sounds, I've heard increasingly of school districts who are thinking about that. How can they, you know, similar to kind of the daily check-ins that a lot of districts have implemented with their students, some are now starting to do daily check-ins around well-being of their educators, knowing that they have many layers of additional stress and responsibility and demand right now. And so I think you're not alone, Michelle, in thinking through kind of what could we be doing more formally, you know, and all of us had to kind of jump quickly in response. And so now some structures are being put in place. And Akia gave some ideas as well. So, you know, this idea that if there were reward systems in place before, don't let those go. So continuing rewarding staff for specific areas, pillar of the week, leadership and beyond, or other awards that you give out. And I know there were some other ideas here in our chat box. So Sylvia mentioned the employee assistance program, and ensuring that we're communicating about those programs to our educators. And I'm going to ask Liz, who's one of our partners today, to speak just for a moment to some of how we can rely also on our community partners, both to support our students, but also our educators. You know, we have a lot of community behavioral health partners, for example, who many have seen a downtick in their provision of services, and yet many are kind of eagerly, you know, there to help the community. So any ideas, Liz, that you have for how we can best, you know, partner with our community behavioral health teams to support our educators? Perhaps we've lost Liz here. So maybe I'll turn the question to Christopher. Christopher, can I? Oh, there you are. Okay.
Here I am. And I had a great comment too. So let's just remember that your behavioral health partners are still working too, right? So they're working from home. They're up virtually. They're you know, as an example, wraparound teams are doing virtual work, and child family teams, and connecting youth to continuing to connect youth to supports and to services as appropriate. Some mobile teams and mobile crisis teams are still actually seeing youth, usually with some protective, you know, gear, like Connecticut is providing that for their mobile response teams. So just remember your community partners, remember the teaming, remember who you were working with before. If you're not familiar with your local behavioral health system, it's a really good time to figure out who's doing what and how they can be helpful partners within this work. You did mention that the numbers have gone down as the reports to child welfare have gone down. So have the reports to places like mobile response and stabilization and mobile crisis teams have also gone down. And the mobile response teams are reporting that they are coming in later than they're used to coming in because families are worried about bringing anyone into their homes. So just what's happening with those mobile teams. As an example, those teams are still available and can still go there early. They can still be engaged early. They can still be part of this work. So if you can figure out how to help them be part of your team, that would be really terrific, and they would appreciate it.
Thanks so much, Liz, and Heather. Heather's comments align with yours, which, she's saying we're a community partner very eager to lend support, and I find ourselves begging to help schools, and some schools may be hesitant to work with an agency outside of the school itself. Please remember we're here to help, and we share your passion for supporting students, families, and teachers. And we know that's part of why it can be so helpful to have these relationships established prior to a crisis or an emergency. So sometimes this is, the impetus, a crisis is the impetus that it takes to foster some of those relationships, but continue reaching out. And for our education partners, just be aware that there are many community providers who really are still operating, and BMason says the same. A lot of community clinics are still operating and supporting children, taking referrals, intakes. Many are doing telemental health and are still here to support, especially in the context of so much loss in the community. So we see a lot of comments to that effect. I want to loop back for a moment to the idea that was brought up earlier about how to best support our educators. And two comments came through that I think are really critical, and then I'm going to direct Michelle back to you for a moment. The first from Stacy Skolsky saying, can you ask Michelle to talk more about how the PBIS structures, or the multi-tiered system of support structures for teachers, look? We always hear about what's present for kids, but having it available for teachers is unique. And just for everybody on the line here, just this idea that we have universal supports for all, whether it's students or teachers, and then we're kind of continuously monitoring to see if there are additional needs. And so this idea of doing it in schools is really critical. But another question that's related, Michelle, that comes from Lisa is, how can we increase trust with the school system between teachers and admins? And I'm bringing that question up in the context of the multi-tiered, because sometimes, teachers may be reluctant, for example, to say to their administrators, hey, I have a mental health need, or I'm not doing so well, I'm really stressed, and I need my EAP, or I need something in place. So can you speak to us about that, Michelle, kind of both the structures and then also how to foster that support and trust?
Yes. Again, I'm grateful to be in the position that I'm at, because I feel like we had a lot of those structures in place. We already had a structure in place where we have a mental health team meeting every week. We've continued that. So every Monday, our mental health team meets and we talk about kids, but we also talk about staff. Who are we worried about? I also have an instructional coach who's part-time, who also, she'll hear a lot of things before I hear them from teachers, and she'll ask me for resources to support those different teachers. So whatever your structure is, it doesn't matter what the title of the person, or if you have what you call a mental health team, whatever it might be, what are the things that are in place that work normally in a normal situation, and how do you continue those virtually? We have always talked about that idea of how you differentiate professional development, or how you differentiate instruction for students is the same way we differentiate professional development or supports for staff. And so and when I say we, I could lean on any number of people within the building. I am the only administrator, and so I have to rely on other people, and I think that's important to do regardless. Who are they connected with? Who are we checking in? So our mental health team will also go through a list of, well, we're looking at students we're concerned about. We also talk about staff. Who's checked in with so-and-so? Let's pair up some people to be doing some checking. Is anyone, we have a teacher who's also raising her granddaughter, whose daughter went into the ER overnight. Just so she let someone know, and within 20 minutes, I had 10 texts. Do you know about this? And I did. But just the same things you would do for kids. I can't say that enough. If when we worry about kids, it's because they're humans, right? So let's worry about ourselves as humans as well. How do we connect with each other? How do we ensure that we are monitoring how people are doing? We have professional learning communities, and we're continuing that structure. So we see each other at least once a week through that. And then again through the office hours. And what I've noticed is that the people who call in on my office hours are typically people who just need human connection. And sometimes will just need to talk for a little bit. For people in situations where maybe they don't have that same kind of setup prior to this, think about who's your trustworthy person on your staff. Who does everyone go to, right? Like I probably shouldn't say this on here. Who's like the bartender or the hairstylist that everyone is in their ear and talking to them. Have them be your eyes and ears. Figure out who those people are and have them, ready to provide some resources for staff that might be struggling more so. And honestly, it could be the administrator who's struggling. So what's your plan to step in and support the whole school, regardless of who might be hurting or struggling and regardless of what their needs are? But differentiate that and have that plan for how to connect people together, regardless. And I think some of that came through with yes, we have these informal kind of check-ins and virtual happy hours and all that kind of stuff, but we know our staffs. Get out of staff lists. That's the one thing I took home when we left for spring break, and which then ended up being end of the year break in some ways. And I just go through that almost every day. Who have I not heard from? Who am I concerned about? Am I the right person to reach out to them, or who might be? And just differentiate that support like you would for kids. Make sure they know they're valued and seen.
Love it. Thank you so much, Michelle. Just this idea of really ensuring that we're building those tiered systems of support for our educators, including our administrators, and not just for our students and families. We know that one of the real concerns and even burdens for educators right now is trying to ensure that they are effectively understanding and supporting the well-being of students and families. And part of that obviously involves family engagement. There's been a lot of chat in the last few minutes about how do we effectively engage families, and some good ideas about parent cafes and using virtual technology to do that. But a couple of questions, and I'm going to ask Jane Walker, who's with us today, and a family leader, a national family leader, to speak to a couple of the questions that have come up around this idea of family engagement. So one is from Shirley, who asked specifically around, from a parent perspective, what does a parent do if a school is refusing to or is not putting into service what they say they're offering in writing? That's one of the first questions. So Jane, if you're there and can kind of speak to this idea of how does a family navigate that in this virtual world?
That's a concern that we hear many times over, even pre-COVID. And when I say we, I represent a network of family organizations across the country who are designed to support other families who have children with special needs. And so we often link families to the family organization in their community or their state to help them navigate systems, to sometimes help them communicate better, to sometimes help them understand processes, things like that, that families may not naturally understand without some assistance in navigating that. I've seen a lot in the chat box about incredible work, and I know that families do struggle at times with the school system, but I do also want to acknowledge the incredible work that teachers have been doing in this current situation. It's just incredible. I think a Blue Angels flyover is warranted for teachers as healthcare workers. Sincerely, I think they've done an incredible job. And that said, we also know that teachers have families too, and that teachers feel so responsible for their students, and at the same time really have to be there for their own children who are now being homeschooled as well, or maybe having behavioral problems, mental health problems with anxiety. So I'm particularly appreciative of this conversation about supporting teachers, because we know from our own experience, we have many teachers who, and mental health providers as well, who feel a double burden because of the need or feeling responsible for caring for a classroom or a client load, as well as caring for their own families. So that's a significant responsibility, and finding ways to lighten that load, I think is a great service to everybody. Sharon, was there another question?
Well, a question that has come up throughout the chat is how can we best engage families? And I know, Jane, that's a kind of general question, but I think especially, our educators are wondering, how do we engage maybe the harder to reach families, or families whose students aren't showing up online or who we're worried about? So any ideas around what can we do to better engage families right now? And in some ways, I'll just say, now more than ever, I've heard from educators, this is a time where we may be able to better engage families. We are in their their and there's, advantages and disadvantages of that.
When we look at the economic situation and know that so many families have lost their jobs, we really are concerned that families are dealing with their concrete needs rather than focusing on their children's education. We know too, in conversations with our family leaders across the country, that families, as I think Selena mentioned so clearly, need to go to work. They may be considered essential workers, and so the ability to focus on school for their children or to be engaged. So I guess my suggestion would be twofold in that area. One is to ensure that the family's concrete needs are being met for food security. They may be worried about housing at this point. They may be just completely overwhelmed. And so acknowledging that from the start. And then secondly, and I've seen a lot of support groups, and our organizations are having a tremendous success in getting families to participate in support groups. Over the spring break, many of our organizations, and I can put in the link to all of the family organizations around the country. They were having daily support groups with families, with youth, with younger students as well. And in those, they were supporting families in helping them get their kids to do their assignments, things like that. So I'd be happy to share some of those resources in terms of community connections, like Liz was talking about, to help engage families, as well as some tip sheets we have on engaging families as well. I'll share those.
Thank you so much, Jane. Really appreciate it. And just the theme of, meeting families where they are, maybe first starting with some of those very basic, seemingly basic needs that may not be met right now. And Selena shared some resources on culturally responsive family engagement. So really appreciate that as well. So thank you for all of the ideas. And there's more in the chat box as well around how we can best engage families right now. And Jane, as you spoke, you did mention, the idea that a number of families and educators are trying to navigate their own families where they may have students with mental health concerns or learning challenges. And educators may be worried right now about how do they best identify and support students with mental health challenges. So I want to ask of all of our attendees for specific strategies that you've seen schools employ around supporting educators to support student mental health. And by that, I mean everything from kind of the daily check-ins with students to if you have seen a really effective strategy for getting, identifying students who may need support to help. I'm going to ask Chris in just a moment to speak to how we can best support our educators, identify students who may be experiencing mental health challenges, in a distance learning environment, trying to know what those signs are, red flags of a mental health concern, anxiety, depression, those things. How do we do that through distance learning? But I want our attendees also to share some ideas about strategies that you've seen in the field for supporting educators, supporting students. So Chris, if you could give us some ideas about how to support and identify students with mental health challenges in this distance learning environment.
Sure, it's such an important question. I think it starts by having a sense of a baseline of your students, and fortunately, this is happening later in the school year. So, most of us have had an opportunity to develop relationships with our students and have a sense of what they do well, what their kind of challenges are, what their triggers are, and starting with a recognition that we are in the middle of a pandemic, and so I think we have to forgive a lot as, the best adaptation that we're all having to an extremely traumatic event. Now, not all traumatic events result in trauma, and what we want to pull for is the inherent resilience in our children and in ourselves. So I think it starts by knowing what does this particular student's baseline look like, and then in what ways might they be starting to engage in behaviors or patterns of interaction that would seem to signal they're in some level of distress. And then how do you figure out whether that's a normal level of distress and within the range of adaptive responses to a maladaptive environment, or when does it become problematic? And I'd say really it becomes problematic when it's impairing their functioning. So is it impairing their ability to learn when they had previously been a sponge for learning? Now that's also challenging because we're asking them to learn through a completely new medium. And so, it's going to look a little different remotely than it might look in school. And what I'm hearing is actually some students who were more difficult to engage in person in the classroom are loving this new medium. And other students that were stars and probably had a lot of reinforcement around the social engagement are struggling more through this more remote medium. So part of that is also contextualizing what we're asking of them. But, I think you want to know, are they showing up when they're supposed to? Are they able to engage in learning in the ways that they used to? Are they appearing more irritable? Are they spontaneously crying? Those would be more obvious signs. Do they look disheveled? How do they look physically? And is that, a departure from how they would normally present themselves? A child that really used to care a lot about the way they presented themselves physically to others suddenly is looking very disheveled or unkempt. Could be a sign that they're struggling. What I'm seeing in the literature is a lot of anxiety and then also a significant amount of depression. And those seem to be the two most common symptoms of young people who are starting to struggle. Obviously, if it's a student that already had some underlying mental health challenges, you would look for a worsening of what their baseline behaviors look like. But I think this, is so global and so overwhelming, not just to the students, but also to their supporters. So to their parents, to the teachers who are trying to educate them, to their community providers. Many have experienced direct losses. And we've been robbed of the ability to grieve those losses in appropriate ways. So we just, we're all dealing with a tremendous burden right now. And I think what we want to do is try to, something I learned from one of these earlier calls, do our pandemic best. So what does that look like for each of your students, and how do we support that?
Great. I just put that phrase in the chat box, do our pandemic best, because I don't want to forget it. It's important. We're all trying to remember to give ourselves and others grace and validation for the stress that we're feeling. So that's a helpful phrase. And Chris, one more follow-up to that. First of all, I want to call out that Kathleen mentioned that, the awareness that anxiety and depression may be indicators of underlying trauma and adverse child experiences. But also Sanji Lawrence asked us, how do we normalize the call for mental health services during a crisis? So the comment was, many families are reluctant or even unaware that they may be experiencing trauma, but they may absolutely benefit from support or services. And so the question is, are there things that we can be doing as educators, as school systems, to help normalize this call for mental health services if a family, feels they need them or might not be aware that they need them, but could benefit from them?
Yeah, I think it starts by, being real and owning your own challenges. And I think that can be so validating when there's an appropriate amount of self-disclosure, and so long as it's about the student and not about yourself, I think self-disclosure can be completely appropriate. And I even do that in some of my clinical work. And it allows for a rapport to be developed. It allows for a natural connection. You become a real person when you're talking about your own struggles from this pandemic. You obviously don't want to make about you, but I think properly dosed, that kind of self-disclosure, that kind of real engagement can be incredibly powerful and validating. Oh my goodness, even my teacher is kind of struggling to figure out how all these pieces hold together, or parents, even my child's teacher is talking about managing both their children in the home and trying to get them to learn. And, think about what a relief that is, right? Because we're asking so much of our educators, of our families, and of our young people. So we should expect that they're not going to be able to perform in the same way, our educators, our parents, or our students, or our children. And so figuring out what's the good enough, right? And part of this is also what phase of this response we're in, right? So I think at this point, we're out of the shock and the dismay and the adrenaline rush that came with the first couple of weeks. In the Boston area, we're now 7 weeks into this. And now we have this long horizon line of 2 more months of school. And so how do we stage our responses and ensure that we're able to go the distance, both for ourselves, for our students, and for our families and children? Because I think, again, there's been so much great conversation about good self-care. And I think so many of the ideas that people were floating around self-care are those kind of first-level primary universal interventions on the MTSS model. But, looking out for when people are starting to go from level 1 to level 2 to level 3, and thinking about what are the supports and services that both the students would need at those different levels, but also the educators. And I thought it was a great question, like, what does an MTSS model look like for educators? And some of the services at Tier 2 and Tier 3 would mean, maybe reaching out to your employee assistance program, or asking a colleague. I think because administrators are also in evaluative roles with educators, it can sometimes be difficult to share that you're struggling. And so perhaps that's easier to do with a peer, or a subject lead, or someone who is seen as not in an evaluative role, but could still steer you towards, or steer your colleagues towards, appropriate resources for good mental health. The age-old adage, put the oxygen mask on yourself before you put it on the child, is so important to remember in this crisis. Because if we're not keeping ourselves in a good state of emotional well-being, we're going to be less effective with the students and the families we're working with.
Thank you so much, Christopher. And Nellie reminds us also, as we're thinking about outreaching to families and trying to create awareness and normalize mental health services, that we need to be culturally sensitive and aware of the family's values really is key when we are communicating about mental health services with families. So thank you for that reminder, and Christopher for your ideas there. And a few of you have started bringing up, which is the direction that we anticipated the conversation would go, kind of what next, right? So we talked about the timeline, and you know, Natalie asked in planning for future. A little bit of background noise. Go ahead and mute if you're not. Natalie reminds us in planning for future school closures. So during the next academic year, for example, what's the best way to front load our students with possible future school closing to better prepare them without re-traumatizing? And in that same vein, kind of thinking about next year, the reopening of schools or whatever it might look like, I wanted to ask Michelle first, how are you working now, if you are? I know we're kind of day to day in many ways, but how are you working now to prepare educators in your school for the return to school? Are you even there yet? And also ask our attendees, what are your ideas for how we can best prepare our educators for the next academic year? So Michelle?
So yeah, we are there. So so in Colorado, we get out of school. Most districts get out of school before the Memorial Day weekend, and so we're wrapping up this year. And as we wrap this up, we have to be cognizant of the fall. Our governor has been pretty clear that we need to have a plan in place, and I think I love the do our pandemic best. I think that's great. And I think that we should be learning from what our pandemic best was, and where the gaps were and what those barriers were, particularly in relation to equity for all of our students and our families and our staff. So we, as a school district, I can speak to that. We are pulling together representatives from all different walks of educator life and talking about what will our return to school look like. Even if we're in brick and mortar, it's going to look different. And from a mental health standpoint, you know, what do we have in place to support kids coming back after months and months of not having that consistency they've had in the past, as well as what will our families need and what will our staff need. And then we're also thinking about professional development needs. How do we need to continue to build the skills that we had to quickly try to develop and that we're still developing, particularly for staff, but also how will we assist our families? It is a beautiful time to really build our family engagement, and really go from family informing or family engagement to family partnership, because we need them and they need us. Yeah, Jane. And so this is a great opportunity to build on, what did we have in place that helped that? And what did we have in place that maybe got in the way of that? And how will we change that? So we're putting together kind of a threefold plan of what does it look like to come back if we're full brick and mortar? What does it look like to come back in a potentially hybrid model, where you might have kids part of the time or some of the kids, or however that might look? And what happens in a full virtual model? I feel like we should plan for a virtual model. Our county health department has basically said that if anyone that is in direct contact with a school, so a family member, a student, a staff member, attracts COVID in the fall, they'll immediately shut down the district. So it's not, I don't think it's if, I think it's when. How do we maybe take advantage of that time coming back? For us, it's mid-August, to reconnect with our kids and with each other. And, I'm elementary and I have early childhood as well. How do you do that with kindergarten? And establish relationships quickly and powerfully with new staff and new kids and new families, so that promotes us moving forward with this in a time when we'll probably be virtual again next year at some point. And what have we learned again? And how do we partner together? And how do we do even better in our next pandemic or the next phase of pandemic best? What does that look like? So if people aren't doing that yet, I would highly recommend that you speak to the voices that make those kinds of decisions. I know every state is different and every district's different and regions, but I think we need to have in the back of our head, what will this look like and what can we learn from this experience, and how can we be preventative in nature so that we can perform in our next pandemic best 2.0 in the fall.
Thanks so much, Michelle. And Pamela shared a link to a return to school roadmap. So it looks like there's people not only thinking about it, but really preparing roadmaps, just as you said as well. And want to ask a couple of our panelists, questions related to what you mentioned about some of the professional development needs. Ellen Desmond, at the beginning of our conversation early on, posted in the chat box that she would love to learn how other state departments of ed or districts are dealing with grief and loss in communities due to COVID deaths and an inability to grieve as usual with loved ones. And I'm bringing that comment back up because what we know is that we're going to have a lot of children coming back to school who've experienced tremendous loss, and they will have quite complex grief and trauma reactions, possibly related not only to the loss, but how they may have been unable to really grieve in ways that we typically would. And so, Pamela, I wanted to first ask you about how we can best prepare educators in the context of these anticipated increases in trauma exposure and grief and loss. And then Selena, after Pamela, if I could ask of you, are there unique considerations for communities of color, other marginalized communities who maybe experienced even more profound grief and loss during this time? In the context of COVID. So Pamela, could I ask of you kind of how can we best prepare educators to return in the context of trauma, grief, and loss? Wondering if we lost Pamela. See her? Oh, there we are.
Are you hearing me now?
Yes, now I can hear you.
Sorry about that.
No problem.
So, yeah, I just want to echo what Michelle was saying about the importance of professional development. One of the things that we've been thinking about is the reality that, like people have mentioned, many school campuses are open and students are going there to get meals or to get other things, but are the school staff that are the access point right now for engaging with students, what is their training in things like psychological first aid, identification of the student's particular mental health needs? Often the people that are really that frontline staff right now are the ones that often get left out of these professional developments. And so I really think we need to think broad and wide about making sure all staff start to share this trauma-informed lens. The other thing that I want to say about professional development and really focusing on educator wellness is really using that time to support educator well-being. And whether it's going through curriculum, it's that idea of not asking them to do something additional, but using some already carved out time as an opportunity to support educators. So I think those might be two really important adaptations for schools to think about in terms of how they're using professional development time. But the point is well taken that the demand is likely to be very high. And so we need as much frontline staff at that universal level really prepared and ready to support, and then we're able to see, who's going to bubble up to tier 2 and 3.
Great, thank you, Pamela. And I know a few resources were shared earlier on about training the education workforce in mental health competencies as they re-enter the classroom. There's some free resources out there. I know another free online training is coming out from SAMHSA this fall in that area. And Pamela shared some from her center. There are also free online trainings for trauma interventions specifically intended for schools. Pamela, maybe you can share some of those. And Selena, if I could ask of you for a moment to speak to some unique considerations around how can we best prepare educators in communities of color, other marginalized communities who may be experiencing even more profound grief and loss.
Yeah, so, a lot of times when we think about COVID, we think of loss of a life, but there's also grieving of routines, grieving of friends and relationships and peers, particularly for students, and then also grieving of adult attachments. So oftentimes students, are not only attached to their teachers, but they're also attached to people in their after school programs. So it's important that we're not just focused on resources within the school, but also resources that lie in the community as well. Some boys and girls clubs are offering telemental health services to young people who have experienced adverse childhood experiences, who've experienced trauma, to continue that relationship building, continue services. So just, don't want to, ignore the community resources that are still active in the community. And then finally, I would also mention the importance of faith-based partnerships in addressing grief and loss for many communities of color, faith and spirituality, and for other groups as well is really important. So remembering to integrate faith leaders as well in addressing those needs.
Great, thank you so much. Michelle, I'm going to ask you to share a closing final thought as we move toward closing out our session today. If you could just take a few seconds to give us a closing thought in the spirit of supporting educators in the context of this pandemic, and then we'll wrap up.
This Michelle? Malvey?
Yes, this Michelle Malvey.
just double checking.
As our resident educator, yes.
No, I gotcha. I think the biggest thing is, I feel like I've said it over and over, and I can't tell you how excited I am to go back and check out all the resources that you've all been sharing. This is definitely like a 15-way street of sharing all the great things that are happening. In terms of finishing up this year and planning for next year, how will we support our educators as we tie up a year that unlike any other they've ever experienced? How do we have opportunities to be grateful and show that gratitude towards them? Open up lines. It used to be we kind of like locked up the building, right? And then in general didn't see each other until we came back in August or whenever it might be for your state. But how do we keep some lines of communication going throughout the summer? We're going to need that. We're going to need to know, we need to have a plan for how we will connect with our educators on an ongoing basis without it feeling overwhelming, like more that they have to do, but an option and a place to land in fall. And we're going to have to think about, like, what does that look like in the fall? How do we continue to create opportunities for everyone to connect and have those relationships with each other? So, but again, we've got to support each other. We've got to support administrators, superintendents, all the way down to our custodians who have never faced something like this before and who have their own worries and all kinds of things going on. So what will we do for each of those groups? And then how does that transpire and trickle out to how we support our families, rely on and partner with our communities to provide the absolute best for our kids, which is why we're all here. So.
Thank you so much, Michelle. And thank you to all of our attendees today and to our panelists for everyone's active discussion, active participation. And we'll be sending all of the resources shared in the chat to everyone who registered. And your contributions really do demonstrate that together we're stronger in creating forward-looking solutions to address the challenges and to think forward with optimism and hope for tomorrow. So thank you again. Please remember to take care of yourselves while caring for others and while caring for your communities and families. So really appreciate everyone's time. Take care, everybody.